Hello everyone, my name's Danny, and in this series I'm going to try and explain what a spinal injury is and how it could affect you. Now, I'm in the unusual position of both having a spinal injury and being a medical doctor, and while this in no way makes me an expert in spinal injury, I think having the day-to-day lived experience has helped me to appreciate what life is like a bit more and understand the implications a bit more than I otherwise might have. And hopefully by using that combination of knowledge and experience, I can explain to you what a spinal injury is and how this will affect you. Whether you have recently acquired one, and if so, welcome to the club, or maybe a loved one has and you just want to understand it better, it's a whole new world that's hard to understand and navigate, and hopefully I can help with that. A quick disclaimer would be that this is not medical advice, and my aim here is purely to educate and help people understand their injury, maybe dispel a few myths, and ultimately help you live a better life. So I think to understand this properly, we need to have a brief look at the relevant anatomy here. Now, your spine, or backbone, is composed of three sections: the cervical spine, the thoracic spine, and the lumbar spine. These individual bones are referred to as vertebrae, or vertebra for singular, and their job is to protect your spinal cord as it carries nerves from your brain to the rest of your body. The cervical spine has 7 bones, the thoracic has 12, and the lumbar has 5 bones. Now, it's important to appreciate this because spinal injuries are classified according to the part of the spine in which they occur and the numbered vertebra. For example, I have a T4 injury, which means my 4th thoracic vertebra is damaged and the cord along with it is damaged, meaning that all nerves below that level are functioning abnormally, shall we say. Now, if your spine is damaged for any reason, and this is usually trauma, then this results in a spinal injury. I'll go into a bit more detail in a separate video, but broadly speaking, spinal injuries are separated into complete and incomplete. Complete meaning there is no movement or sensation below the spinal level, and incomplete meaning there is some preservation of function to a greater or lesser extent. Again, in reality, it's slightly more complex than this, but for the purposes of keeping things brief, that's a helpful way to start looking at things. You can also classify the injury according to number of limbs affected, and you might have heard this referred to as tetra or quadriplegia. That means 4 limbs affected. If you're wondering the difference between the two, then it's just Latin versus Greek. They both mean the same thing. Quad, tetra means 4, plegia means paralysis. And likewise, paraplegia means 2 limbs affected. Although even that's slightly misleading because you can have paraplegics who have no abdominal or trunk control, which has really significant implications for balance. So you'd think paraplegia just means your legs, but actually it can be so much more than that. Generally speaking, the higher the injury, the more severe the injury. And this brings to mind a saying that we learned in medical school, which was C345 keeps the diaphragm alive. So that's your 3rd, 4th, and 5th cervical vertebra. The nerves that emerge at that spinal level innervate your diaphragm. So if you're injured at that level or above, then you lose the ability to consciously move your diaphragm, which means you can't breathe for yourself. So at least initially, you'll need help from a ventilator with actually breathing. So again, that emphasizes the higher the injury, the more severe the injury. So the vast majority of spinal injury comes as a result of trauma, and that's usually motor vehicle accidents, sports injuries, falls, or violence. A smaller proportion of spinal injury is non-traumatic, and this can be a tumor compressing the spinal cord, an interruption in blood flow like a spinal stroke, or an autoimmune condition like multiple sclerosis. Because most spinal injuries are traumatic, they're often accompanied with other injuries like traumatic brain injury, injury to soft tissue or bone, and injury to other internal organs like your liver or spleen. Now, this is important because if, for example, you have to have your spleen removed, then this means you're at a higher risk for certain infections and you will have to take antibiotics lifelong. So I mentioned earlier that if you are injured at a particular level in your spine, all of the nerves below that level are impacted. Now, the first thought of most people is, oh, that means my legs, and that means I can't walk. And whilst that's true, you soon come to realize that this also means the nerves controlling your bowels and bladder. Again, this varies slightly according to how damaged your spinal cord is, but almost everyone has some degree of bowel and bladder dysfunction. To make it a bit more digestible, I'll split the consequences into 4 main headings, and that is motor function, sensory function, bowel and bladder, and autonomic nervous system. So your motor function is conscious movement of your muscles. And with a complete injury, you'll have no voluntary movement of your muscles below the level of injury. With incomplete, you may have some preserved function. For sensory function, this doesn't just mean feeling someone or something touching you. It can also mean your awareness of your joint position in space. This is also referred to as proprioception. Sensation can also mean hot and cold sensation, and this can have huge implications for, well, can you guess it? Getting burned. And I have had my fair share of burns over the past few years, unintentionally, I should hasten to add, just by carelessness or lack of awareness. So it can be really important in terms of the implications. Bowel and bladder, I think this is the big one that catches a lot of people off guard. But the long and short of it is that you lose voluntary control of your bowel and bladder. The sphincters that you could previously clench when you felt that you had a full bladder, say goodbye to that. They will just leak when your bladder becomes full enough, resulting in an accident. And the way this is managed initially is with an indwelling catheter. That's essentially a plastic tube held in place with a small balloon which drains into a bag. Now, over time, many people move to intermittent catheterization. So the clue is in the name. You pass a catheter every now and then, every couple of hours. Or some people have a suprapubic catheter, which is inserted directly through the skin into the bladder below your belly button. And that can be helpful if you have limited dexterity or hand function, such as those with cervical injuries. The bowel side of things is initially managed by the nursing staff looking after you, and they'll sort out your bowel routine, but this is something that you'll have to learn to deal with as time goes on. And again, I'll make a separate video on it because it is a whole topic in itself. Finally, the autonomic nervous system. Now, this is a part of your nervous system that is not all of the functions that aren't under voluntary control. For example, your heart rate, your blood pressure, your temperature regulation, and so on. Once again, your level of injury will determine just how much your autonomic nervous system is involved, but typical consequences are symptoms like lightheadedness, your heart racing at rest, and an inability to regulate your temperature, which can be particularly challenging in the middle of winter or summer. So this one is really tricky because you have to ask yourself what recovery means to you. Most people, at least initially, interpret this to mean, will I walk again? Or will my function return to what it was before injury? And it's impossible to give a catch-all answer to this. However, what I can say is that while some people do regain function, it's very rare to completely regain full function, and most individuals are left with a degree of permanent impairment, be that weakness, loss of sensation, or bowel and bladder dysfunction. For many people, recovery starts to mean adapting to a new life with your injury and trying to find purpose and meaning within that. And this takes various forms, but it could mean going back to work, getting into a new relationship, or being able to travel again. Now, if you are newly injured, then all of this will seem hugely overwhelming, and it is, but all I'd advise is taking things one step at a time, if I can use that phrase. Spinal injury is unavoidably a hugely life-changing condition, and it can be incredibly challenging to accept and tackle all of the daily trials and tribulations that come with it. These include, but are not limited to, your bowel and bladder accidents, your musculoskeletal pain, your nerve pain, pressure sores, falls, losing some or all of your independence. The list goes on, but I think what I'd emphasize is that you're not alone, and whatever you're going through, someone's been there before and got through it for the better. I've met many people who thought their life was over after their injury, only to have gone on and had incredibly fulfilling and meaningful lives. Every now and then, a new, seemingly miraculous treatment makes headlines, with promises to be a breakthrough for spinal injury, but I would just caution against chasing after the notion of returning to your life just as it was before injury. As a general rule, nerves don't regrow, and for all the headlines, the long-term prognosis in terms of recovery of function remains essentially what it was decades ago. Now, not to sound too doom and gloom, despite this, all of the overall prospects and quality of life for those with spinal injury has improved hugely over the past 30, 40 years. And this is due to changes in societal attitudes towards disability, better accessibility in public spaces, with a huge caveat that this depends on where you live and has a long way to go still. And finally, advances in technology like wheelchair technology. That's come a long way. So I would argue that you absolutely can recover from spinal injury, but it might not take the form that you initially envisaged. So this has been a brief overview of this wide-ranging topic, and I'll try and address individual topics in separate videos, but hopefully it's given you a basic understanding of what a spinal injury is and the implications of having one. If you found it helpful, please give this video a like and subscribe, and pop a comment down below if you want to ask any questions. I'll do my best to answer. Thank you very much for watching, and we'll see you in the next one.